Life is quite unfair. Every one of us is going to lose everything we have and die. The more money we make, the more science we can do. Just like SpaceX, Elon's mission is to go to Mars. My mission is to solve aging. Over the past 5 years, China has surpassed all the countries in the world in terms of its capabilities to experimentally validate AI. The ecosystem is so well established and so friendly that I can come and establish a globally present business. I was maybe 5. I like to lie on the ground and look at the stars. One of those days I thought, well, how cool would it be if we could travel very long distances? How do we become the next Columbus? Around the world, we have most of the areas are very well explored, so we need to go outside. And if we are to go outside, we need to be able to sustain for much longer than what we can today. When I was going through high school, we've seen the technology revolution happen. And I decided to go after computer science to first make some money and become much more sustainable as a scientist. So I always wanted to do science, but I also wanted to pay for it myself. I didn't want to ask the government or other people to help me. So that's how I got into Insilico. There were many hurdles when we started the company. Our first fundamental problem was acquiring high-level talent to go into this field and commit to this type of research. At that time, deep learning scientists were like NBA football players. They were extremely expensive, very scarce, very arrogant, and very difficult to talk to. In Silicon Valley, some of those deep learning scientists could go for $1 million a head. So we had to improvise, and we started performing multiple competitions where people competed around very complicated tasks in order to get onto Insilico. We paid them reasonable amount of money to join. They joined my team. And many of them still work with Insilico. In the early days, it was also very difficult for me to get funding because I was not a very reputable scientist in drug discovery, and most of the technology investors at that time did not understand drug discovery. I was always very honest with people. I explained the risks. So the failure rate in novel drug discovery is 99%. At that time, even some of the most sophisticated technology investors, once you explain to them how long it's going to take and how much it's going to cost, they were not prepared to give the money to somebody like me, who has never discovered a drug. So I invested everything I had in the company. Thanks to my background in GPU computing, I could afford to risk this money. Well, at that time, we figured out that deep learning is the technology that will allow us to generalize and reason within very messy data and also across the many tasks. And we decided to bet on that particular technology on both biological side and chemical side. And that was very unusual because at that time, the medicinal chemistry community, the computational chemistry community, they were not very familiar with the capabilities of those technologies. They thought that they were too futuristic, and the promise that those technologies could bring would be realized maybe 50 years from now, not today. The original step when you had to convince people that the technology really works and establishing this loop was very difficult. In very recent years, we've seen several revolutions. Well, first of all, in 2012, we've seen the first revolution, which was reinforcement learning. Then another revolution That was ImageNet, the ability to recognize specific objects and pictures. Then GANs, generative adversarial networks, the ability to generate images with your desired properties. If you want a bird with specific color feathers, it could do it already. 2022 was the year where the first ChatGPT moment happened. Now we've seen two more major advances. One was the DeepSeek moment. A highly capable small group out of China demonstrated that you can open source. And then another revolution happened with OpenClaw. One person using vibe coding demonstrate that you can now use very capable orchestration engines that can complete entire tasks, learn, self-evolve, acquire skills, and work with multiple types of AI. Every one of those revolutions gave us superpowers. The first revolution allowed us to very efficiently predict what therapeutic targets are driving disease and aging at the same time. The second revolution and the third revolution allowed us to generate molecules with desired properties. The third revolution, foundation model revolution, allowed us to reason within the entire drug discovery process. And the final revolution, the OpenClaw revolution, allowed us to orchestrate everything automatically. However, all of those revolutions would be nothing without the infrastructure and the human talent revolution that happened in China. Over the past 5 years, China has surpassed all the countries in the world in terms of its capabilities to experimentally validate AI. So this wonderful fully robotics automation lab that is now run by AI, and we've demonstrated we can now have a lab claw, lab lobster, that you can prompt to perform many scientific tasks in a fully automated way. So it's based here in Dachin Park. It's part of the Shanghai Pudong Development Group's scientific R&D ecosystem. This lab represents a testament to our commitment to full automation, rapid drug discovery, and also a stepping stone for the next project. Here you've got the imaging station. So here you can do several types of imaging, and you basically here you're preparing the samples for the omics loading. We're also establishing workflows that allow us to go to the next level. So in Top Town, we want to build the lab that has never existed before anywhere else in the world. So here is where we work. So you've got a residential area. Here you can live. So it's like 25 minutes from Shanghai Pudong Airport, about 15 minutes from Zhangjiang. We're trying to go around the world and promote this area. They're not paying me anything for that. I'm just saying it's the best place to live in the world. So now even clinical trials can be started faster. You still have to do everything by the book, but just the sheer number of patients, number of people involved, and actually favorable oversight that is not trying to stop you for the wrong reason is just staggering. So AI plus this infrastructure combined allowed us to cut early stage drug discovery at least 4 times. So something that used to take you 4.5 or 5 years can be now done in 9 months to 12 months, which is previously unimaginable. Race and win and achieve a milestone, you need to celebrate. And today we're celebrating, right? So let's celebrate first in humans and race to phase 2. And right now I actually want to get Dr. Ren on stage, and he is the true hero of this. So Dr. Ren, first in human. Idiopathic pulmonary fibrosis is a rare disease that is associated with a rapid decline in lung function. It usually affects older people. Average age of onset would be around 65. The reason it's called idiopathic is because it has an unknown origin. The only thing that those people have in common is that they are older. if we try to go after a very narrow, rare, age-related disease and demonstrate the improvement in lung function, we would be able to develop the next generation of this drug that will be even more capable and will be able to go beyond IPF and go into cardiovascular diseases, CNS, into Alzheimer's and Parkinson's, and many others. So for us, idiopathic pulmonary fibrosis is a very important stepping stone towards aging. Rentosertib is the world's first drug that I know of where AI was used to identify a novel target, so identify the mechanism that is driving the disease, then design specific type of chemistry that disables this mechanism, that managed to reach Phase II trials and complete Phase IIa trial successfully, demonstrating very promising increase in forced vital capacity in the amount of air that you can breathe out of your lung. This is one of the few drugs in the world that actually showed promising increases in forced vital capacity. After 65, your forced vital capacity declines regardless of whether you have IPF or not. So increase is very rare. So we were very encouraged by this first data. My co-CEO, Dr. Ren, called me at 2 a.m. in the morning. He said, Alex, I have something to tell you. Let me walk you through the data. I said, well, tell me, is it successful or not? The results were mind-blowing and unexpected to me. So I was crying for like 2 hours. I am not easily affected by emotions, but seeing the promising increase in forced vital capacity that is dose-dependent was a life-changing experience for me. It's like, I don't have children yet, but I think it's a comparable experience with the birth of a child, or maybe even having this child get into, Beijing University or here in Fudan, then graduate honors, top of their class, all at the same time. We ran 2 clinical trials for this project. We decided to run 2 parallel ones, one in China and another one in the US. In China, the trial has completed more than a year ago. In the US, it's still ongoing in early stages. That proved the point that doing a proof of concept trial in China is not only more efficient, but also with higher quality data and with very high quality clinical trial management. That is why when we presented the data to CDE, the Chinese Drug Regulatory Authority, they actually knew my drug even better than I do. I was blown away. So now we are going full steam ahead, planning our Phase III trial in order to maximize the chances of success. If this drug gets approved, it will be the first fully AI-generated drug with novel target, novel molecule to the approval. It will be the first such drug in China. Our objective is to develop drugs that can go after aging. In addition to IPF, we have multiple other pipeline elements that follow the same template. We have a drug for inflammatory bowel disease that is associated with the decline in barrier function in your gut, in your intestine. So we developed a molecule that goes after barrier repair. So repairs those microscopic damages that you accumulate in inflammatory bowel disease, but also in aging. And we have many other drugs that have the same purpose, that may work in a disease, but later could be repurposed into age-related conditions, and then potentially extending life for everybody. Shanghai is a very open ecosystem with very favorable government policies, with very favorable infrastructure, with decades of investment into fostering innovation. massive investments into education, in manufacturing, biologics testing. Many contract research organizations are based in Shanghai. Thanks to all this ecosystem, we think that there is no better place in the entire world that can be even created at this point in time that is better than Shanghai Pudong and specifically Zhanjiang and surrounding areas. For me, as a foreigner, I don't speak Chinese and I do not exactly understand the Chinese culture the way I should. But even for somebody like me, the ecosystem is so well established and so friendly that I can come and establish a globally present business. All of that can be done here by anyone. As long as you're good, you will succeed. I really like the quote of one of the great leaders, it doesn't matter whether the cat is black or white, as long as it catches mice. Here I have proven that hypothesis many times over.